Welcome back to my YouTube channel where I'm documenting my long haul COVID recovery. So if you haven't seen the other two, I think I've done one more episode, See Memory Last. That's the big thing with long COVID. If you want to see my other episodes, you can check them out. This is an update on where I'm at, where I was going. Last episode was quite positive because I was in the high of, these ebbs and flows in long COVID, and I was feeling good because I'd overcome POTS. And I still don't actually have POTS, so that's really good. POTS is something that you can check at home. It's where your heartbeat gets irregular from standing up for too long. Okay, so an update on what has happened to me over the past week or so since I last checked in. I have been crashing so hard. Last Thursday at 3 p.m. I literally lied down in bed because I couldn't do anything anymore, and I couldn't get up until Tuesday. That is really, really difficult for me to accept, to even tell people, to feel. My emotional body around that whole thing, that whole experience was huge. And also the symptoms. So it was exactly the same as having COVID. I had exactly the same symptoms. It felt exactly the same. I did a test, obviously it was negative. I think that the virus in some form still lives on in the body, I think in the gut. So my symptoms from the crash were high fever, nausea, lots of dizziness and vertigo, extreme fatigue. Obviously, I was in bed, and I'm an active person. I like to do a lot of stuff. I have a 2-year-old that's not, it's not normal. It's not how I feel like I would want to stay in bed that long. I was just literally unable to move, and I have widespread pain in my body, and I still have this localized pain around the neck, which is a weak point on my body. Anyway, I have this subluxation in the neck, and I get this stiff, rigid neck sometimes. And it seems that COVID will go to any weak point and just exploit it. And then just the confusion and headache and a little bit of tachycardia. But as I said, that's subsiding now, and that seems to be less and less, which is good. Obviously, the heart is extremely important, and if you're having issues with tachycardia, you should definitely get a scan. I've already done a thorax and cranium scan, but I'm also going to do a cardiogram as well, just to check further with the heart. So medically speaking, I've been to the doctors. They sent me to the neurologist, and they've diagnosed me with this post-viral fibromyalgia, post-COVID fibromyalgia. They don't know how to treat it. They give me strong medication, which doesn't help me. And I'll talk a bit more about what treatment I've been prescribing myself. And I called the doctor up after this crash, because this was the worst I've ever felt, and it actually felt like COVID again. So I called the doctors. Luckily, here in Spain, I have private health insurance as well as national health insurance. There's an availability here, but I still feel like there's a lack of long COVID infrastructure. So they sent me to the Dr. Garcera, which is like the head doctor, your main doctor, like your GP, the neurologist, traumatologist, cardiologist, rheumatologist. And I have to go see these people regularly, and it's kind of overwhelming, especially when you're somebody that's struggling with chronic fatigue symptoms post-COVID. I would much rather have one clinic where I can go in person. It would make things much more streamlined, and people that are specialized in that, because I feel for the fibromyalgia community that have been suffering this for a long time and not really being heard, because um, the doctors don't really have much idea or training or understanding of this whole area, the whole area of dysautonomia in general. So besides that, I'm looking to find a dedicated long COVID clinic, and I think in the UK there's quite a few, and I'm sure different areas across different countries they are researching it, they're trying to understand it. So I saw that there are some drug trials going on in the US at the moment for a drug to treat long COVID. That being said, I have also contacted a functional medicine doctor because, as a natural doctor myself, the the, the prospect of working with somebody, a doctor that can treat me holistically, makes so much more sense, and makes me feel more secure and safe, and there'll be more treatments available on offer than other than just prescribed medication, which is not helpful for me. Also, I've done privately some tests. So privately, I've contacted a couple of labs to get a micronutrient panel test so that I can have a global view of that. Because the analytics that I've been doing with the hospital and stuff, they're kind of basic stuff. They don't go into a deeper level, which the micronutrient panel should tell me a bit more. Also, I've done a test, a stool sample for my gut microbiota, so I can have a look at what's going on in there. And then I've also done a test for deficit of DAO. DAO is the enzyme that breaks down histamine along with vitamin B6, copper, and vitamin C. So, if there is a deficit of DAO in the blood, this enzyme, if there's a missing, not so much of it in the blood, then that should indicate that there's obviously an inflammatory issue going on, and it could well mean that there is an intolerance to histamine as well that could have been triggered by the viral infection. Okay, so when I get the results for that, I'll do another update on what's going on there. But I'm doing all of those home test kits apart from the deficit of DAO. I just went to the lab and asked them to do it. So you can, look online in your local area, check with a local lab, see what you can do privately if you can't do it with your doctor already. Just a few statistics here. So 10 to 15% of people are reporting these long haul COVID symptoms. I know personally from speaking to people that they have long COVID, but then they're not dealing with it with their doctor, or they've not spoken to anybody else about it, but it's still prevalent. And actually a new study just came out in the US that is giving a statistic of 25% of people that have had COVID. And that doesn't mean anyone, it can mean anyone. You have mild symptom, asymptomatic, whatever, you can still develop long COVID. And when you think there's 240 million worldwide cases, that's a whole pandemic in itself of long COVID. Not surprisingly, 75% of those people are women. Our bodies are more complex. We make humans, we have a complex hormonal system. I personally have noticed that COVID is much more, the symptoms come much more intensely and has dysregulated my hormonal system. But during my menstrual cycle, it's much more intense. So I can already see that personally, and it's no surprising that women are affected more. The British Heart Foundation at Oxford have said that long COVID, this is the leading researcher, he said that long COVID is having a truly devastating impact on countless people across the world and leaving many with a sense of hopelessness. So that is also the reason why I'm doing this YouTube episodes, just to keep, well, personally, because I have memory loss, I can remember, but also so that I can just put my story out there, and hopefully my healing journey will help others as well, because there's many of us out there, and we need to support each other, because there's not a lot of information. And sometimes, like for example, yesterday when I was on the phone with this one doctor, it was kind of depressing, not really helpful, and there are other things out there. So I just want to empower people and help people to understand that they can get better. There are solutions. I'm sure of it. I'm sure that we will recover, and there is a possibility to recover 100%. But this is just the process that we're in. Obviously, as well, it's not just the illness itself. People are getting sick from the vaccine. I know some people personally in my family, family member that also had gotten really sick from the vaccine from after each dose, had a stroke, in fact. So there is lots of things to consider when you're on the healing journey. Personally, I like to do energy healing as well. That's something that I'm really passionate about. I'm also working with other therapists to help me overcome this in terms of mind, body, physical, all elements of me, a holistic treatment. One thing I'm not good at is pacing. I thought I was pacing, but I had a really busy week running up to that crash. And so I really have to be super, super careful and be more conscious around pacing. But when you're not used to it, and you're used to doing lots of things, it's hard to adjust. And personally, it's also mentally to accept that you can't do those things is also challenging. So it's getting to that point where I can accept that I need to do less and not to keep pushing, because it just hits out of nowhere and it's just boom, that's it, I'm out and I can't do anything. And that's what just happened to me, and I really do not want to go back there, especially as it feels exactly like COVID. I mean, the high fever, everything, it's really uncomfortable, really not fun. Working with plenty of other therapists to help raise my frequency, raise my vibration. And also, I think a lot of this is tied to epigenetic trauma that we've carried through in the blood lineage. For example, we don't just carry our own trauma in life, we also carry the trauma of our family, our ancestors, and this gets trapped in the blood. And I think this is where toxins and viruses and things as well can also cling into the system energetically. So really working on cleaning and clearing that through, along with all of the other treatments that I'm doing. Because depending on you and your history of viral, different viruses you've had, your environment, the stress that you had, your childhood, trauma that you had in childhood, and all of your families, and that genetic predisposition is what's going to determine all of this that happens in how the virus attacks your body, because it has a multiple way of attacking the immune system and getting in and hijacking those cells. So it depends on everyone, and personally I think that it is also causing a mast cell activation syndrome in the body, which is this over alert immune system, which then attacks the body itself as well. So how am I managing my long COVID? At the moment, not so good, as I've just told you, but I'm learning. I'm going to do some more pacing. Some symptoms have gone, others did come back. Again, still working with the medical community, but also doing my own due diligence and doing my own lab work and working and looking for other therapists to work with and doctors and metaphysical therapists as well. So to summarize, I think that this long COVID has triggered this mast cell activation syndrome, which is a dysautonomia, which is an automated nervous system dysregulation. And I'm managing it through a multidisciplinary approach, as with all holistic medicine. I think that's always the best way to tackle illness. I'm also doing a low histamine diet. I've not completely, fully 100% implemented it, but I am working on fully implementing it slowly. That's helping. I can already feel the difference of that. It's basically an anti-inflammatory diet. I'm also using CBD, which I think is helping. I'm doing CBD capsules. I also take melatonin and tryptophan, and I think that definitely helps. The tryptophan also helps with the mood, because it's also difficult to accept chronic disease. As I said, I really believe in the power of belief. So I believe that 100% I will heal from this. Look at the work from Bruce Lipton and see, the power of belief and how that has function over your cells as well. Just look at the placebo effect. I mean, that already gives you a strong indication of the power of belief. I'm also looking for a good PEMF device, which is a pulsed electromagnetic field device. This helps with widespread pain in the body, areas where there's pain. It's with this pulsed magnetic electric frequency that it helps to break down the stagnation of the energy in the tissues and relieve pain deep inside of the cells. So that is what I'm working on at the moment, and I hope that was helpful. Again, I'm here if anybody wants to DM me, write a comment, ask me anything. If you're not sure about something that I've said, I'm available, so you can write to me and I will reply. And if there's anything else you want to ask me to talk about, you can also do that. And I will, if you subscribe, then you'll obviously get a notification when I give you my next update. And wishing you all blessings, and I hope that we all recover 100% from this. And as I say, just leave me a message if you want to. Take care, everybody. Goodbye.